debt, on the verge of dying. Workers were wondering if they'd get their next paycheck. Sometimes we're accused in this business of only telling you the bad news, and that's why Steve Dunlop went to Jersey City today to get an update. The hospital says it's turning the corner, on its way back.
Some believe the seeds of failure at the Jersey City Medical Center were sown the day it opened. The sprawling complex was said to be FDR's thank you to New Jersey Democrats for delivering Hudson County in 1932. Railroads provided lots of tax money and medical care was cheap. But from the start, the place was just too big. 50 years later, the problems had come home to roost. The medical center was getting payment on only half its bills. 30% of the patient load was indigent, and when a new state aid formula required hospitals to show how many poor people they cared for, JCMC could not because of sloppy bookkeeping.
Certainly their credit and collection procedures were far from adequate, and in fact I would go so far as to say that they were poor management systems.
Harvey Holzberg, formerly of Lutheran Medical Center, heads a management team which took over the city-run hospital in June 1983. He asked Jersey City politicians not to interfere. So far, he says, the request has been honored. After filing for Chapter 11 bankruptcy protection, Holzberg's first move was to computerize billing procedures. It quickly paid off. Today, JCMC says it is recovering 100% of its costs, compared with 70% 2 years ago.
When the patient is discharged, that bill is automatically sent to either the patient's insurance company or the patient themselves if they're paying their own bill.
Just as you should have been doing all along.
Well, I certainly will not defend past practices in an institution that I was not at.
With finances on the mend, the management could turn its attention to patient care. It began a 3-year, $6 million buying spree to bring its aging equipment up to date. The changes have had a good effect on employee morale, which had been sagging.
It was difficult to get supplies. It was difficult to get extra help. People didn't want to come here when we did have resignations because they had heard about it. So for that part, it was difficult. Today, it's much better. We've gotten a lot of our positions filled with the nursing staff. Administration's been very good about that.
Even the State Health Department agrees that Jersey City Medical Center is in much better shape now than 2 years ago. But in the meantime, the hospital's physical plant remains overly large and inefficient. Officials are now seeking to float FHA-guaranteed bonds to construct a new hospital downtown. The 400-bed facility could be ready by the early 1990s. Which would leave this 10-building complex, now known as the Jersey City Medical Center, empty. But nobody builds anymore with stained glass windows, terrazzo floors, or marble walls. And hospital officials feel that someday this might make a great condominium. In Jersey City, Steve Dunlop, Channel 5 News.
And the Coronation Company says it's developed a safe and effective